My name is Dr. Don Beasley. I'm the owner and provider at Boise Ear, Nose, and Throat. I'm originally from Dallas, Texas, and I grew up there. My mom happened to be the office manager for the Dallas Cowboys orthopedic surgeon when I was a kid. That was a pretty cool thing to be affiliated with at that age when you're 12, 13, and 14 years old. So at about age 15 or so, I was hired by the Cowboys doctor to be the custodian at the office. So I was up there, mowing the lawn on the weekends, edging, buffing the floors after work, straightening out the magazines in the lobby and that sort of thing. Well, I got to know the doctor. He became a mentor of me, not to be an orthopedic surgeon, just to go into healthcare. And he actually wrote a letter of recommendation for me for medical school, which I think did not hurt my chances of getting into medical school, actually. So the reason I decided to go in ENT specifically was primarily through just luck of the draw exposure I had. I happened to take an advanced head and neck anatomy course in one part of my education, and it was taught by an ENT doctor. After that semester let out of school, he invited anybody that wanted to come watch him operate. And I called him up, and he said no one was ever taking him up on that opportunity ever in his career, but I did. So I met him in the operating room one day, and he let me scrub in on a case. I had no idea what I was doing. I got to watch and observe and kind of even assist in a case, and I was like, this is all over. This is what I want to do with my life. Prior to opening up Boise Ear, Nose, and Throat, I worked for a number of years for one of the large hospitals here, and there I had some pretty neat exposure. I was able to get teamed up with a neurosurgeon there and did a lot of the skull-based cases there, which you can think of it as being sort of like a very advanced sort of a sinus anatomy exposure in a way. And it was a great relationship. And I became just fascinated and kind of in love with sinus anatomy and treating sinus problems. What actually led to my desire to open my own practice was restrictions I felt working for the hospital. The main thing was that I wanted to get into this whole balloon sinuplasty treatment for treating chronic sinus infections. And the hospital didn't support that. They're very traditional, and they didn't want to make changes like that, stuff done in the office. Being able to perform sinus procedures and treat patients with sinus issues in the office was a huge deal to me, because it is the wave of the future, in my opinion, for treating sinus infections, not for all patients, but for the vast majority of patients. And I didn't want any limitations on being able to do that. Being in private practice allows me to run my own show, make my own decisions, and do what's most important for the patient, which is the only thing we should ever be considering.